Hi, my dear friends. I am Dr. Yusuf Chunawala. I am basically a pediatric dentist. I have done my specialization or my master's, that is MDS, Master in Dental Surgery in Pediatric and Preventive Dentistry. I am basically a children's dentist. Now, I see a lot of kids regularly in my practice, and many parents have this one common query: are the milk teeth important? So my answer is very simple. Now we have to understand, see, teeth are God's creation, okay? And every tooth that comes in the oral cavity, they come at various times. If you have observed a child very carefully, I mean, when the child is born, he doesn't have any teeth because there is no requirement of a tooth at that particular time, because the nutrition that he is going to take is purely milk. Then as he grows, maybe 6 months, 8 months, that's the time the first teeth start erupting in the oral cavity or coming in the mouth. So that's the time, if you understand, the diet changes slightly. Along with milk, the child is also having a soft diet. So, and as he moves further, by the age of 2.5 years, he's got 20 milk teeth in his mouth. And if you understand, by the time he's 2 years of age, generally he is off the mother's milk. Okay, so that's the time the child starts eating a little bit of regular food. So milk teeth are very important, and the first most important function of milk teeth is mastication. If you have teeth, the child is able to chew properly, eat properly. Just imagine if you have a severe toothache or there is continuous problem when you are eating your food. What happens? You tend to gulp down your food. You don't chew your food, and we all know that chewing of food is a very, very important aspect, and it plays a very important role in digestion of the food. So the first function of milk teeth is mastication, that is, it helps us in eating food. If you are unable to eat food properly, a variety of problems will set in. Now the second function of milk teeth is aesthetics, looks. I mean, when we smile, the first thing that is noticed is our teeth. And really, my dear friends, I mean, we should not underestimate the looks aspects in children also. Children are also very conscious about their teeth. Many a times you see these little kids, 2-year-olds, 1-year-olds, 3-year-olds, and even 4-year-olds, the front teeth are in bad shape. So when they smile, they genuinely look ugly. So many parents, say we don't want to do any treatment because they're going to fall. Now understand one thing, that looks is important for all of us. See, now what happens? See, suppose in adults we have something, we have a little bit of reasoning and a little bit of understanding. For example, now if I'm losing hair, you will not call that person a baldy or something directly. You will be like, let it be, why should I tell? But in children, what happens? In school, when they go, when they're 3-year-olds, 4-year-olds, when they see something different, they might tend to make fun. So if a little boy whose front teeth are bad, and another boy or a group of children make fun of him, so what will happen? Either he will, start staying aloof, he will avoid going to school, or he might tend to develop an inferiority complex. That is one kind of a behavior. The second kind of the behavior is he might trash all the other kids. So looks is also very important. So the second most important function of milk teeth is looks. And every child, it's the right of the child to look good. Now what is the third function? The presence of teeth, especially the front teeth, it allows us in speech. It helps us in talking, phonetics. Now just imagine a situation if your front teeth are missing. Try pronouncing a word like sure. When you say sure, your tongue tends to touch the front teeth. Now in this situation, if the front teeth are absent, then the tongue tends to pop out. So slowly, speech defects will also develop. Now the only problem, sometimes with speech related thing is that it takes a long time to develop. Hence it is very easily neglected. So, and the last function of teeth is the presence of teeth. Not only does it allow mastication, looks and speech, but it also allows in the overall growth and development of the facial structures. And hence they are very, very critical. And then now the next point which I would like to discuss is that people generally think that by the age of 5 or 6 all the milk teeth fall down. Now understand one thing, that there is a specific time period for falling of each tooth. Say for example the front teeth, the front 4 or 8 teeth are generally lost between the age of 6 to 7 years. Okay, the canines are lost between the age of 9 and 10 for the lower, and approximately at the age of 10 to 11 in the maxillary or in the upper arch. And the back molars, the milk molars, are lost anywhere between 10 to 12 years of age. So every milk tooth has a schedule, they don't fall all together. So you need to save them for as long as possible. Now these are the basics about milk teeth. In my future videos we are going to talk much more in detail about what are the causative factors of dental cavities in children, what are the various habits like thumb sucking. We're going to talk about various habits also in children, and a variety of other things will be discussed in the other videos. I'm really thankful to all of you all for giving me so much time. It would be great if you could subscribe to my channel, share it with your friends, and do like it too. Thank you so much for your precious time.